From all of us at Nunnally, Freeman, and Owens, we want to personally thank you for trusting us with your dental care or the care of your loved one. We are dedicated to the very highest standards in treatment and personally invested in our patients' wellness and their rapid and complete recovery. We are frequently asked many questions about post-op procedures, and we wanted to take a few minutes to answer those questions and give you some detailed guidance for immediately after surgery and the days to follow.
Because of the use of PRF, or platelet-rich fibrin, we rarely have anyone leave the office needing gauze over the surgical sites. However, some bleeding is of course normal with oral surgery. Even when a small amount of blood is mixed with saliva, it can look like a lot of blood. In some cases, some oozing of blood can still occur and is normal up to 24 to 48 hours after a surgical procedure. You can keep several damp gauze over the surgical site for an hour after leaving the office or until the gauze becomes completely saturated with blood. After several hours, if bleeding persists, moisten a tea bag in cold water and place it over the surgical site and apply firm, constant pressure. The tannic acid in tea helps to constrict the blood vessels and helps stop the bleeding.
Facial swelling is normal following oral surgery and usually peaks 2 to 3 days after surgery. We will let you know if we think you need ice packs after surgery. If so, we recommend ice packs 20 minutes on and 20 minutes off while you are awake. After the third day, if there's still some swelling or stiffness, moist heat is recommended 20 minutes on and 20 minutes off.
If you have discomfort, the use of 2 aspirin, 2 Tylenol, or 2 ibuprofen every 4 hours is usually very effective. Occasionally, we'll prescribe a pain medicine which can be taken the first day or 2 following surgery. If you need pain medicine, we recommend that you take it at the first onset of pain. Most pain medications are better tolerated with food, and we always recommend that you don't drive or operate heavy machinery after taking prescription pain medicine. One of the great advantages of our protocol is that acupressure before and after treatment often negates the need for prescription pain medication.
We rarely need to use antibiotics after surgical procedures. And the reason is we have a number of different adjunctive procedures like intravenous vitamin C, acupressure, and ozone therapy, all of which preclude the need for us to use antibiotics.
After your surgery, cool, soft foods and non-carbonated beverages are best for the first 24 hours. Protein and fruit-blended smoothies are ideal. If you are diabetic, continue to follow the regimen, which helps you maintain your blood sugar.
Good oral hygiene is essential for wound healing. We would prefer you not rinse your mouth for the first 12 hours after surgery. The day after surgery, rinse with a solution of a 1/4 teaspoon of pickling salt in a glass of warm water. You may brush your teeth the day after surgery.
It's important that you take it easy after surgery and allow your body to heal. Avoid becoming fatigued. Rest as much as possible during the day and get a good night's sleep. Avoid smoking for the first 24 hours after surgery. Smoking can delay wound healing and lead to a dry socket if a tooth's been removed. After surgery, you shouldn't drive a car, operate machinery, or undertake any business matters for at least 24 hours.
It is possible to have a headache post-operatively. Occasionally, conscious sedation or general anesthesia will result in a headache the next day. Also, numbness of the lower lip, chin, and/or tongue are possible. Usually, this is a temporary condition and it will correct itself within a few days to several months. There's also the possibility of some black and blue marks which might appear on the cheeks and chin or jaw near the area of surgery. This may begin as swelling before resulting in discoloration by the second or third day. The color may progress from black and blue to yellow and green and may progress down your face onto your neck. It will gradually disappear over a week or two and may be helped by moist external heat. Your body temperature may be elevated during the first day or two following surgery. Be sure to drink plenty of fluids, and if the fever persists, we would want you to call our office. Rarely, but occasionally, a localized infection may occur in the surgical site in the weeks following surgery. If you have a sensation of increased pain, fever, or increased swelling or stiffening of the jaw after 48 to 72 hours, please call us. Occasionally, small, sharp fragments of bone may work their way out of the gum tissue during the healing process. This is more common after multiple extractions, and it's really the body's way of reshaping the ridge. This process may last anywhere from 1 to 4 months. Impressions for bridges and partial dentures or full dentures should be postponed until the ridge is well healed, and this usually takes 6 to 12 weeks. It really is our honor to serve you. Please don't hesitate to call us if you have any questions.